Got it. Okay. Transition Stakeholder Advisory Council meeting for November 6th, 2025. For those that I have not met, my name is Chanel Pugh. I am the InReach Unit Manager or Supervisor. And so my team oversees group InReach, individual InReach, rapid reintegration, at-risk diversion, and the transition escalations. So nice to meet you if I haven't met you already. I just wanted to do a quick reminder. We are going to be recording the meeting today. So if you would avoid using protected health information, if you have any questions or anything that you want us to discuss, you can add it to the chat. We will be monitoring that and then also stopping to answer questions there. These slides and slides from our other meetings will be available on the website right here, the Transition Coordination website. And then if you're listening by phone, press *6 to unmute your line and *9 to raise your hand. You are able to turn on closed captioning. If you look at the bottom of your screen, it should pop up, and then you can just turn it on by clicking the CC link. And then if you are requiring any kind of accommodations for this meeting, please email this email hicpuff504ada@state.co.us at least 1 week prior to the meeting to get that set up. All right. And then this is just what we do. The Department of Healthcare Policy and Financing administers Health First Colorado, Child Health Plan Plus, and other healthcare programs for Coloradans who qualify. And our mission is to improve healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. All right, so this is our meeting agenda for today. We have our partners from AssureCare. They'll come in and they'll talk about CCM and just some updates or changes that they've made particular for our team. And when I say our team, I mean LCAs and TCAs. And then we will have them going forward to ask questions or things like that. So they'll pop into our meetings, our TSAC meetings moving forward for the first 30 minutes or so. So if there are things that you guys want to ask them, you'll have the ability to do that on an ongoing basis. Another thing that we will be implementing is that we will have a Google form that will go out prior to each meeting, and then you can put your question in there. And if you have a question about CCM, it would be super helpful for you to put it into that system or into that form, just so that we're prepared to have those conversations and we have the correct people in the room, also the correct resources. After that, we are going to have someone from our PACE team come in and talk about Program for All-Inclusive Care. Then we'll have another person from HICPUF come in, Lori Thompson, and talk about person-centeredness and do kind of a training on that. And then we will have an update on LTSS-PE. I believe that's going to be by Amy. And then we'll just discuss at the end our future meeting topics and then have a questions and open discussion. Any questions or adds for the agenda? Okay, pausing and hearing none, I will move forward. So we will have AssureCare. I believe I have Vanessa with us right now. Vanessa Sparks and Brianna. I will hand it over to you.
Thanks, Chanel. Am I able to share my screen? Looks like I am.
Yep, there you are.
From you. All right. So can you all see the Google Drive? Okay. All right. Want to just say hello. My name is Vanessa Sparks. I am a product trainer with AssureCare, who is the company who brings you the CCM system. And so we're here today to say hello to you and to introduce some training materials to you. I live in the state of Wisconsin. I live about 90 miles north of Chicago, and today it is an overcast 50 degrees for me. So hello from the state of Wisconsin, and I'll let Brianna introduce herself.
Yes, hello. I am Brianna Grinke. I'm also a product trainer with AssureCare. I am Vanessa's next door neighbor in Minnesota, so we have very similar weather. I'm about 60 miles north of Minneapolis, so in just St. Cloud, Minnesota.
Thanks, Brianna. So today what we wanted to bring you all was some information about where you can access information on how the CCM works, what you are seeing when you're in the CCM, what you can do and what you should do in the CCM. And so what we're showing for you here today is the Google Drive, and Brianna's going to put her link to the Google Drive in the chat just in case you don't have it. But I want to point out to you that where I've landed here, I'm going to go back just a little bit. We have quite a few folders in the Google Drive. And the one that is most used is the one that is labeled CCM and Bridge System Job Aids and Resources. So when I click on that folder, I find a lot of material. So I'll let you know that we have something around 90 PDFs listed here that tell you everything you ever wanted or didn't want to know about the CCM. It's a lot of information. And a lot of this information is geared toward all of the different kinds of users who access the CCM. And so we want you to know that we have been working with Chanel and her team to sort of streamline some of these resources for you so that they are more accessible to you. So you'll notice that at the top of this list of many, many job aids, there are two folders. One is called Local Contact Agency Resources and Transition Coordination Agency Resources. So if we click on this folder for Transition Coordination Agency Resources, we have a much smaller list of job aids. And we want to point out to you that we've sort of compiled some of these resources for you to make them more accessible. And we wanted to point out a couple of really important things for you to be aware of to help you access and manage all of this information. So the very first item here under a folder with demo recordings says Transition Coordination Agency Care and Case Management System, Training Resources Glossary. It has like 2 zeros in front of it so that it always falls at the top of your list when it's arranged alphabetically. We want to really call your attention to this because this is what we think is going to be a really useful resource for you. So let's take a look at it. When I open this glossary, it is exactly as promised. It is a listing of some items that we think are going to be useful for you. And it's specifically for TCAs. So this is a listing of job aids, resources, and other recordings that we feel will be useful for you in your role in the CCM as a transition coordinator, perhaps. So you can see it has a table of contents. It also has a link to the CCM case management workflows for case managers and LCAs, so that if you wanted to access information, wanted to make sure you understand, for instance, what do case managers do in a particular scenario, or what do LCAs do in a particular scenario, you can access that listing of job aids as well. But this is particularly for TCAs. It has a table of contents that you can quickly access, but basically it's a listing of training resources for you. So job aids, which are documents that walk you through step-by-step with screenshots, particular areas of the CCM. And it tells you the title of said document and gives you a little synopsis of what you're going to find in this document. So for instance, access to a member's record and member agency transfers is identifying how transition coordination agencies and care providers receive access to a member who is active with another agency for additional access, things like this. So you can look through and find job aids that might pertain to some question that you have or some process that you're embarking on. You'll see here that also we have a listing of videos that might be useful for a particular scenario. And these are typically very quick videos. 5 minutes-ish, so that you can take a look and really quickly watch a walkthrough, a recorded walkthrough of like activity logs. How do you use activity logs? What should you do? And then any other training resources would be listed here. Now, each of these you can see has a blue hyperlink. So if I want to know about care teams, I can click and I will be brought to that particular job aid. And this will show me all that I ever wanted to know about care teams. Also note that these also have table of contents. So there are certain job aids that might have a table of contents that mentions TCAs or LCAs, directing you to a particular area of that job aid. So you can click on it and it'll bring you to that specific page. I'll also let you know that in this folder are the demo recordings, so you can look at that as well. But moving back to a wider view, also wanted to point out another important folder that you're going to want to be aware of, and that is the system user-friendly release notes. So if I click on this folder, what I'm going to find is a listing of documents that tell me about releases. So you know how sometimes your phone updates? Well, Apple and Google don't do a very good job of letting you know what has changed. You just have to stumble upon it, right? Well, we will tell you what is going to change so that you don't have to stumble across it. So if you look here, we had a recent maintenance release on October 15th. You can open this document and it'll tell you what you can expect to see changed in the CCM. Now, we also update job aids when necessary when there's an update, but sometimes you just want to know just quickly at a glance what's changing right now. Also point out to you that within these release notes that list for you, again, a table of contents and then details what changed in the CCM, that we do have these little audience indicators. Some things are really pertaining to case management workflows. Some are pertaining to LCA workflows or TCA workflows. And some of these items apply to everyone. So you'll see indicators like CMA audience. And this means that this entry, this change really just impacts case management agencies. And so you don't really need to worry about that. And I'm scrolled to the end of this document and we're going to see that there is one known issue that was resolved regarding LCAs and the care teams. And this is for all audiences because everybody sees the care teams and is concerned with who's in the care team and who has access to a member record. So we want you to be aware of these important areas in the CCM or in the Google Drive that are going to help you with your navigation in the CCM to make sure that you are fully aware of how things work and how you can navigate and do your job in the CCM. So we would love for you to share this information with your folks to make sure that everyone is fully aware of where to find a concise, consolidated list of resources for the CCM geared toward your particular role that you play. Okay, so transition coordination, local contact agencies, and then also that we have a glossary that is going to be useful for you to navigate and look at those job aids. I'll also point out something that I'm sure you're aware of, but is going to be very helpful, is that the Google Drives are sortable. So I can sort by name, recent to non-recent. And we're struggling to load here. And I'll show you one good tip here is that you can sort by date modified. And I have it sorted here by date modified. And you can see that just today, we had a new job aid that was updated. And on October 31st, we had new job aid. So this is going to help once all your folks get really used to using job aids and using these resources, they'll be able to track really easily when something has changed. We do let everyone know when there's a change through the email blast. However, sometimes it's good to just come in here and take a look and see that there has been a new job aid perhaps added that might pertain to you. So we just wanted to give you guys a quick overview of some of the organization that we've done of some of these job aids, resources for the CCM to help you out so that you can effectively and efficiently perform your roles. And we hope that this is going to be helpful. And of course, we are open to comments, suggestions, questions from you all. Does anybody have any questions? Maybe about me and Brianna's role as trainers in the CCM. Do you have pressing questions? Is this something that you guys have been using? Have you been seeing this? It's fairly recent that we organized these.
It looks like Colleen raised her hand.
Okay.
Hi there. This was a great presentation. Thank you very much. I do have a question because I see here on this page, new hire case manager learning curriculum. Is that if we hire a new transition coordinator, is that a file that they can go to help train them on CCM?
That is a fantastic question, and I'm glad you asked it. You can certainly use this document. I'll tell you it's geared toward case managers. And Brianna and I are working with Chanel and her team to get a specific document for LCAs and TCAs. So that is coming very soon, that we'll have a specific document that is exactly what this is a help for you when you have new individuals with direction on how to get them trained on the CCM. So thank you for that question. It is coming soon.
Great, thank you.
Thank you, Vanessa. Thank you, Brianna. Do we have any other questions for these ladies? Okay. As I said, they'll be back, so you'll get to see them pretty often. And they'll be available to answer any questions. As Vanessa said, we're in the process of trying to get an ongoing new hire training set up for LCAs and TCAs as it relates to the CCM and what programs you'll be using and what's available in there for you all. So be on the lookout for that as well. Thank you all.
Thanks.
All right. So next up we have Carla from PACE. I believe she's on here too.
Yep, I'm here.
Awesome. And then I don't know, is the rest of your team on, Carla? I know you're presenting, but
Yes, I have the PACE team. Winter Roberts is here, Samantha Erickson, Chris Gutierrez, and Megan Doss.
awesome. Thank you. And I will hand it over to you.
Okay, I am Carla Pradia. I am the Supportive Long-Term Care Programs Unit Supervisor for the PACE team. I'll be presenting the Programs for All-Inclusive Care for the Elderly, also known as PACE. The program is designed to help others or older adults stay in their homes and in the community safely and as long as possible. Next slide. PACE provides care to meet participants' needs 24 hours a day, 7 days a week, every day of the year. Services delivered at PACE centers, homes, in their home, inpatient facilities. The services include primary care and nursing, therapy services, personal care, nutritional counseling and meals, transportation, and appointment to activities, socialization, and other approved services to support their overall health. Next slide. The interdisciplinary team provides the bulk of the care for PACE participants. The team members include primary care providers, registered nurse, social worker, therapists, recreational or activity coordinator, dietitian, PACE center supervisor, personal care attendant, driver, healthcare coordinator. All PACE participants have an interdisciplinary team to provide and ensure they receive the services that are needed. Next slide. Eligibility requirements. They must be 55 years or older, living in a service area of a PACE organization, in need of nursing facility level of care, and able to live safely in a community setting at the time of enrollment. Next slide. To enroll, PACE organizations determine if applicants can live safely in the community settings during the time of enrollment, as I mentioned before. The local case management agencies determine the level of care for the eligibility. The County Department of Human Services or Social Services determine the financial eligibility for Health First Colorado. Private pay options are available for those not financially eligible. Next slide. Transition services ineligibility. The PACE participants are not eligible for transition services. And that's because the PACE program is a state plan benefit and not an HCBS waiver. There has been confusion around people thinking that the PACE program is a waiver, and it is not. PACE organizations receive monthly capitated financing that allows the organization to pull payments. So all of the PACE organizations have a capitated amount of money that they get every month to provide all the services needed for a participant. PACE organizations also assume full financial risk for PACE participants. Next slide. In regards to transition services, also the PACE organizations must accept the capitation payment amount as payment in full for Medicaid participants. They're not allowed to bill, charge, collect, or receive any other funds from healthcare policy and finance. The PACE organizations provide all services, and that's including case management for the PACE participants. If a PACE participant requests to move back into the community, the PACE organization is required to approve or deny that request. Next slide. We provided some contact information. It includes the web page for PACE, also the PACE general email. Next slide. I have the PACE team here to provide support and to help answer any questions you may have. Does anyone have any questions?
You might have said this earlier. Is it still 55 and older?
Yes. See someone.
Hi,
Yes, go ahead.
I have a quick question for you. I'm with one of the local contact agencies, Dr. Cog, and if I have a resident that is in PACE and is interested in transitioning through PACE, what's the best way for me to figure out who to get them in contact with related to their specific case?
They want to transition into PACE, is what you said?
I'm talking about a PACE participant that would be already living in a skilled nursing facility and on PACE. And if they're interested in transitioning through PACE to return to community living, who would be the best contact that I could recommend to that resident?
Best contact for them wanting to go back to the community. First, they should be talking with the PACE center that they're with and talking to their case manager that works with and the PACE center can give them who that contact is. And then Winter, you could probably answer this even better than I can.
Hey, Rhiannon. Yeah, so I would direct that individual to their social worker. That's typically their main contact person at the PACE Center. And I would encourage that person to use the specific term service determination request.
Service determination request.
Yeah, because a service request indicates that the IDT, the interdisciplinary team, is required to take that request back to the team and make a determination as to whether or not they approve that request. It may be that they do think that the person is, maybe their health has improved, maybe they're able to live safely in the community again. Usually the hurdle that we see is just available and affordable housing, but they do have the IDT specifically for that purpose to help that person find the required services if the team decides that that decision is appropriate for them to transition back to the community. If they determine that it's not appropriate for the person and they deny the request, they have to provide appeal rights to that person.
That's very helpful. I'll be sure to pass it along to our team. We encounter a lot of residents on PACE interested in transitioning to the community through PACE. And my last question is, how would I know who somebody's specific PACE social worker is? Or should I just direct the person to call their PACE center to find that information out?
Can call, but they should be able to, and should is not the appropriate word, they have the right to request a list of their existing interdisciplinary team. And so that is a participant right. And when they call the PACE center, they can ask to speak with their specific social worker. And then in addition to that, they can request a list of their current IDT members.
That's wonderful. And if y'all have a phone number for that PACE center that you could put in the chats, that would be wonderful. Thank you so much for all of that helpful information.
Yeah, is it the Denver Center?
Covering 6 counties in the Denver metro area. I can put them in the chat if that works.
Yeah, each center would have, they usually will have a 1-800 number for a general line. But yeah, we can definitely put in the chat the PACE, HICPUF PACE website, and that includes the general contact information. So I'll do that now. And while I'm looking for that, I also want to suggest utilizing the PACE Ombudsman, because they offer free advocacy for our PACE participants. And they, I know that if you're with Dr. Cog, you probably are familiar with some of the ombudsmen, and they're a good crew. So I would lean on them as well if you experience any kind of difficulty with getting in contact with the PACE organization.
Thank you. I am at Dr. Cog, and that's an excellent reminder. I'll pass on to my team. Much appreciated. Thank you.
Yeah, sure. I just put in the chat the link to HICPUF's PACE page. And if you scroll down, you'll see a table that says how to apply. And there's a link for each organization, the counties that they serve, and then their telephone number.
Thank you so much. Sounds good.
There any other questions? Okay, thank you.
Thank you all for joining us. As Carla said, she added the link to their page. So if you have any additional questions, you can find them there and reach out to them. You can also send us any questions that you have, and we can get it over to them for any particular members or anything like that. Okay. So next on our agenda, we have Lori Thompson. She's going to come and give us a training on person-centeredness value. And so Lori works with our CMPQ team, question mark. And she also is our care and case management system improvement unit supervisor. So I will hand it over to Lori. Thank you.
Thanks, Janelle. Can y'all see and hear me? That's a yes. I see some thumbs up. Okay, great. I can't see myself, so I wasn't sure if I had panel access. So thank you so much for inviting me here today. I'm really excited to talk with you about the department's person-centeredness value and how we put that into practice via our person-centered thinking training. And I'm just going to do a brief overview of the person-centered thinking training that was developed by the person-centered practices, the Center for Person-Centered Practices. And so you'll see in the slide deck that their logo is on there. And so this is the unit that we use for our person-centered thinking training. We use this training and we have e-learning modules that I'll give you the link to at the end of this presentation. Next slide, please. So we worked with the Member Experience Advisory Council to develop our own department definition of person-centeredness. And so that the definition that we came up together with our members is thinking and behaving in ways that respect and value individual preferences, strengths, and contributions, and working with members and families, not doing things to or for them. Next slide. This next definition is really the person-centered thinking definition from the Center for Person-Centered Practices. And it talks about that the person-centered thinking underlines and guides respectful listening, which leads to respectful action. It supports people in having positive control over their life and the life that they find satisfying. And really, it is what enables us to have positive relationships with one another, that people are recognized and valued for their contributions, the current contributions they're making in their lives, and the potential that they have for being even bigger contributors to their communities. And people are supported in a web of relationships, both that are natural, their family, friends, neighbors, and those relationships that are paid providers in their communities. Next slide. Person-centered thinking skills are a set of skills that are based on the values that I just talked about, and they reinforce continued learning. And these practices help us to support rather than fix. I don't know about any of you, but I have always tended to be this person that wants to kind of solve problems and fix things. And that natural tendency that I have, I really need to counter it with listening to what people want in their lives and support them to achieve what it is they want and not try to fix anything, because nothing is broken about people's lives. We build on the culture of learning and partnership and accountability. It works for all humans in all settings, and it works at every level of an organization, all the way, from the direct support folks up to leadership in any kind of organization. And it affirms our belief that everyone can learn, all of us that are supporting individuals with disabilities and people with disabilities. We can all learn collectively. Next slide. One of the core concepts in this person-centered thinking is this notion of important to and important for, and then the balance between important to and for. And so the important to concept we'll go over first, and then we'll talk about important for. The next slide. What is important to a person includes those things in life that help us all, we're all similar in this, to be satisfied, content, comforted, fulfilled, and happy. So it includes things like the relationships that we have with one another, with friends, family, neighbors, the status and control in our lives. So if I have status, maybe something that's important to me is my title at my job, or if I own possessions that are symbols of status, that I have control about the decisions in my life, and what I do, where I go. Those things that I do, places that I go, are also important to me. My rituals and routines, I don't know about you all, but I am very much a creature of habit. And so I am very stuck or bound to my rituals and routines. Those are important to me to kind of feel comfortable in my life. And when my rituals are thrown off or my routines don't go the way that I plan them, that can sometimes throw me for a loop. Also, the rhythm or pace of my life. So things like, you know, on Tuesday nights, I go to Zumba, and Sunday I go to church, and then I like to kind of chill out after work every day for a little bit of time. That's the rhythm and pace of life. And then things to have, possessions are all, for all of us, things that are important to us. Next slide, please. So the important to also is what matters most to the person. So it's very individually defined by each of us. We all have our own definition of quality of life. What's important to me may not be important to you. And it includes not only what people say with their words, so what verbally they convey to us that's important to them, but also what they convey with their behavior. So a lot of times, you know, nonverbal communication is a really powerful way that people express themselves. All of us do that without even knowing it sometimes. Next slide. So when words and behaviors are in conflict, we have to pay attention to the behavior and ask why. So a lot of times we talk about, you know, actions speak louder than words. This is the same kind of idea, that sometimes I might say something, but I act a little bit differently about that same thing. And that's a pretty powerful indicator that that's really what is important to me, is what I am conveying with my actions. And so we have to ask why sometimes the behavior and the what I'm saying is in conflict, or why is it different? And now we're going to talk a little bit about what's important for people. And I think about this in terms of basically health and safety, my medical wellness, my mental health, being safe in my home and in my community. Those are the sort of base kinds of important for people. So important for our issues of health, preventing illnesses, and prevention or treatment of illness. If I have a chronic condition, that I have good treatment for that, and I have supports to have that well managed. And promotion of wellness, so diet and exercise are important for individuals. And then issues of safety, so my home environment, that it's safe, that I'm free from physical, emotional abuse, am free from fear. Those are all areas that are important for the individuals we serve and for ourselves. Next slide. Another area of what's important for individuals that we support is what others see as necessary to help the person be valued and be a contributing member of their community. So, for example, one of the things that I feel like is important for the individuals that we're serving is for people not to feel stigmatized. So if they go into their community, that we support them to interact with community members in a way that doesn't pose a risk for them or the other community members. And so in that way, they can be valued and be a contributing member of their community. So those are some of the ways that we as supporters of people with disabilities can support them and focus on that important for. Next slide. So here where we want to talk about what's the important to and for being connected. So if we think about our own lives, what's important to me is connected to what's important for me, because they influence each other. I don't do things willingly that aren't important to me. So for example, one that's in my life very prevalent is that what is important for me is to manage my weight so that I have a healthy weight, and that, you know, that I can have healthy outcomes. But what's tied to that that's important to me is that I look good, that I fit into my pants in particular. And so I do things like go to Zumba so that I can have that important to me that's connected to my important for me. So what's the hook? The hook is what's important to me in order for me to then accomplish the important for me. You can click on, I think we have more things that come up. So it's dynamic. Oops, sorry. It's dynamic, kind of like this slide deck. So the balance of important 2 and 4 is ever changing. It involves trade-offs. So sometimes the important to me is going to override or supersede the important for me. And I might focus much more on this other thing that doesn't end up boding well for my important 4. But what we really need to do is look for the balance between the 2 and the 4, the important 2 and the 4. And that's what we'll talk about next. Next slide. So this is just a graphic of the balance, the scale of important 2 and 4. On the left side, we have important 4. So that's that basic health and safety and being valued in my community. And then the other side of the scale, next slide, is important too. So those are people in my life, status and control, things to do, routines, places to go, and things to have. Next slide. And what we're looking for is that scale to be balanced. Next slide. So this is just a quote that we really like, that Albert Einstein said, if I had an hour to save the world, I'd spend 55 minutes defining the problem. What this is telling us is that in order to help support individuals to realize their important 2 goals in their lives, we really need to understand what makes them tick. We need to know what are the little rituals and routines in their lives that are important to them? What are the people that they care about? What are the challenges that they're maybe trying to overcome? We need to spend the bulk of our time really listening to understand what is important to them in order to then support them in the developing the services and supports that are really going to help them achieve those things which are important to them. Next slide. I like to call this Maslow's hierarchy of need, and it's not the real hierarchy of need, but the triangle is kind of portraying at the bottom those very basic needs that all of us have in our lives, and primarily to be healthy and safe, right? To be housed and clothed and fed and have all of those basic needs met. That's at the very bottom of the hierarchy. And that's the important 4, right? Health and safety that I talked about earlier. And then as we go up to the top of the triangle, we're kind of increasing in moving toward that important 2. So have what and who are important to us in our everyday life. People to be with, people to hang out with, and to share our most important secrets with, and things to do, places to be and to go to, and to interact with friends and family. And then going further up the triangle are having opportunities to meet new people, try new things, change jobs, experiment with different work opportunities, change who we live with and where we live. And then at the very top of that triangle is what we all aspire to, is having our own dreams and our own journeys and getting the support that we need to achieve those aspirations, those personal goals, those things that are absolutely the most important in our lives. Next slide. So implementing person-centered practices is really a promise to listen really intensely to what people are saying to us, not just what they're saying, but what their behavior is also telling us, to continue to listen, and then to act on what we hear them telling us. And, as transition coordinating agencies and the work that you all do, you're really playing that pivotal role in hearing what is important to and for people, keeping people safe as they make those transitions, and also knowing what their goals are and listening to them continuously and finding the best way that you can act on what it is that they're telling you. And if we can't always do what they are asking us to support them in immediately, being honest about how we're supporting them to work toward that. So keep acting on what we're hearing them say. Next slide. And being honest about that, right? So sometimes there are things that are just not possible. So, we need to be honest about, if a person, let's say a person is coming out of a nursing facility and they're moving into their own home and they want to live alone. And maybe that's not safe for them to do in the beginning. And so maybe they have a roommate to begin with, or they have a support staff coming in there really regularly. But it's something that they're going to work toward, kind of backing off on the level of services supports that they're getting over time and becoming a little bit more self-actualized and independent. Letting folks know that that will take time, but that you're right there beside them, planning for those transitions. And when we don't know how to help them get what they're asking for, ask more questions to dig a little bit deeper and try to find out if there are kind of stepping stones to move toward that direction that they're wanting to go. And again, if the person is telling us something that's in conflict with them staying healthy and safe, and we can't find a good balance between the important 2 and 4, that we sometimes need to say that, really it's critically important that you're safe. And so we may be able to meet you halfway on this, but this is a primary important piece. And so just being honest about where we are in the balance of those two. Next slide. And so this, this is kind of telling us to think about our internal biases, is what I want to convey here, is that sometimes when we're working with people, we might, if we know a little bit about them and we know maybe some history about them, and maybe they've had a challenge in a certain part of their life, and we could go into our conversations with that sort of underlying bias and a fear around some of the goals that they might have for themselves, that we need to be conscious of that bias that we have and really listen to what they're telling us and seek to understand what it is that they're saying is the most important piece of that to them, and to be aware of those biases in having the conversation with them. Next slide. So this is just one of the tools that we use in person-centered thinking and some of the person-centered practices skills. This is something that when I worked direct support, that I used for the people that I was supporting. And it's just an example of how you can have the conversation with members that you're supporting. If they're telling you some things that are important to them, you can capture it on this document. And so for the example with Bob, he's saying that it's important for him to be self-sufficient and to be trusted that he can be self-sufficient, to not have someone like looking over his shoulder with everything that he's doing. And that he also, what's important to him is to work with people who are creative, dedicated, and passionate. And so what the people that are supporting Bob need to know about him in order to best support him, he's also telling them this in this conversation that he's having with them, is that he would like the supporter to tell me what you need me to do, and then trust I'll get it done. In other words, tell Bob, what you need him to do, and be confident that he's going to take care of it. He's going to get it done. And if he's not sure, if he needs some help, he'll come to you and ask some questions. And then also to provide opportunities to routinely touch base with coworkers and be able to brainstorm on ways to improve our work. So that's just an example of how this particular tool can be used. Next slide. And so talking a little bit about choice and balance, if we think about that, when we looked at that scale about important 2 and important 4, if we think about, providing all kinds of choice to a member and not being conscious of that balance between important 2 and important 4, that all choice, if they have just, indiscriminate choice, it can be irresponsible. And so a person could be happy, but they could end up dead. I know that's a very brash kind of thing to say, but trying to make a point here about the difference between those two. Next. Yep. And then dictating life, if we're being so controlling and we don't have the scale balance between important 2 and 4, and all we care about is that important 4, and we're saying, we just have to be so careful about your health and welfare that we're just not going to let you take any risks, then you're alive, but you're really unhappy, you're really miserable. And so the support that we provide as a service system needs to find that balance, because good support means that we are looking at both the important 2 and 4 and finding the balance. But it can create conflict. People can get frustrated with us if we are, reminding people of some of the risks that come with some of the choices that they're making. We call this dignity of risk. I'm sure you all have heard that term. And, it's very important that we support people to make responsible and informed choices, but that we also allow them to make mistakes just like all of us make in our lives, right? We make choices, we weigh the pros and cons, and we try to be as responsible as we can. But I certainly, eating all that Halloween candy that I ate this last week was definitely not a good choice. But I did it knowingly, right? And I balanced what was important to and for me. And those are the same, kinds of approaches we must take with the people that we're supporting. And so because we all have that right to make bad choices. Next slide. So this is just a fun graphic that you can click it again and it'll show you the last 4. These are just funny, but they're real. These are real pictures of real folks making some very risky choices. And so I wanted to kind of end with that, and on a silly note, but in all seriousness. Next slide. I did want to just end with this to say that the person-centered thinking tools are vast. This is just one that I presented today, just as an overview of the core concept of important 2 and important 4 and the balance of those. But these other 5 that I have listed on the slide are a part of the person-centered thinking training that we have e-learning modules, and I have the link on the slide there that you can get to this to register and co-train, which is through CDPH&E, but this is our e-learning module. It's available to all stakeholders, including members and their families. All providers can access this training, and then we really encourage you all to access this training to get the whole set of e-learning modules that cover all of these different tools for person-centered thinking and practices, some of which I talked about: routines and rituals, dignity of risk I talked about, but the other 3, working and not working, good day, bad day, and learning logs, are all other really great person-centered thinking and practices that could help you in the work that you do. And so with that, I will ask if there are any questions, and that's the end of my presentation.
Awesome. Thank you so much, Lori, for coming. Do we all have any questions for Lori about person-centered thinking? Any examples of members that you're working with without using PHI that you'd like to talk through? All right, well, hearing none, we'll keep moving forward. Thank you so much for coming and providing us with that training, Lori, and we will be in touch. Okay, next on our agenda, we have a LTSSPE update from Amy, and I will hand it over to her.
Chanel. Hello, everyone. My name is Amy Dearmore. I work here at the department in the Office of Community Living, and I have talked with this group previously about a new program we're working on, which is presumptive eligibility for long-term services and supports, or LTSSPE. And I am here today to talk about an update on this program. Next slide, please. The update is that the Center for Medicare and Medicaid Services has provided verbal guidance that they will be authorizing a 1-year, no-cost extension to our state's 1115 renewal. Next slide, please. And what this 1-year, no-cost extension means is that CMS now has up to a year to review our 1115 renewal application, which of course includes LTSSPE. Where the no cost part comes in is our state's current 1115 demonstration waiver can continue to operate as it currently is and not be subject to increased costs or fees. Next slide, please. So what does this mean for LTSSPE? It means that we are going to continue working on the program, but we just now have a longer timeline and a longer runway to work with. As we get closer to our new planned implementation date of July 1st, 2027, and especially after we receive a final decision from CMS about LTSS presumptive eligibility, we will just pick up right where we paused regarding implementing the necessary system updates, the development and distribution of training material, as well as continuing our stakeholder engagement in the way of office hours and other kinds of outreach. We will continue to keep our stakeholder partners informed and involved as things develop. And like I said, our planned implementation date as of now is July 1st of 2027. I do want to make a note. I have received a couple questions about whether and if or how this affects our hospital presumptive eligibility program. That's a separate presumptive eligibility program, and that does still have a planned implementation date of January 1st, 2026. Next slide, please. As always, you can stay informed. I will put the links actually in the chat in just a second for the LTSSPE website and the 1115 website. And then there's my email address. You can always reach out to me with any questions if you want to know anything specific about updates or the happenings with the program. I would love to ask if anyone has any questions or feedback about this while I get the links and put them in the chat.
There's a question in the chat from Estelle. It says, with the sustainability framework, I assume the PE was no longer happening. Did I read that incorrectly?
So I'm assuming that I'm assuming you're talking about the LTSSPE program, or I don't know if you're talking about other presumptive eligibility programs. Colorado does currently operate a few different kinds of presumptive eligibility, and that's not changing at all. Presumptive eligibility for pregnant women, children, and other kinds of more narrow populations is still in place. That's not impacted at all. Neither is the hospital PE program. As far as I know, that still has a planned implementation date of January 1st of 26. The LTSS PE program, it's just simply been, for lack of a better word, waitlisted. CMS let us know that they have up to a year to review the application. So we believe that it will be approved, and then, moving forward after we hear a final decision from CMS, then we will look to implement on July 1st of 27. And let me right now just put the links to the websites I mentioned in the chat.
Okay. Thank you, Amy. And we'll pause for any additional questions for Amy related to LTSSPE.
I just also want to highlight that we have so appreciated throughout the stakeholder engagement and outreach that we've done, all of the feedback and support and suggestions and questions that we've received. every bit of it has been helpful with our plans, with our program planning and our considerations. So we will definitely reach out again to all of our stakeholder partners as that date grows closer.
Awesome. Thank you, Amy. So then this slide is just about upcoming topics, some of them that you requested and some that are suggestions from your HICPUF partners. So rapid reintegration, possibly having the Department of Veteran Affairs come in and talk to us, waivers 101 or HCBS 101. And then I have rapid reintegration on there again. But any of those kinds of programs, I'd like to open the floor for any additional suggestions for topics that you all are interested in and would like for people to come and present or do a training during this meeting. Holding. Okay. If you guys have any thoughts or ideas, please reach out to myself or Matt, and we'll try and get it added to our topics list. Okay. And then now we'd like to open the floor for open discussion and questions. And it doesn't have to be a question for HICPUF. It could be a question for another TCA, another LCA, maybe something outside of this group, and we need to take it back for individuals in HICPUF. Like, we're here to support you all and have those conversations and find those answers for you. So if there's anything that you would like to know, please let us know. And it looks like I have Tina raised her hand.
Yes, sorry. Quick question. So I work with Mom's Meals, and we provide the medically tailored home delivered meal service. So we're one of the 6 providers in Colorado. And with food insecurities being where they are in today's state, we have tried to figure out how we can support families if we have mom, dad, or grandparents on home delivered meals and there's children in the home. Of course, they're going to give the food to the children. And if they're getting it for A1Cs, it's just going to mess up their own personal health while they're trying to support kids. So do you know of any resources we can kind of direct family to so that everyone in the household is getting food options? Or is Colorado looking at any of the 1115 monies that they got last year for home delivered meals to kind of support the current state of the state with food insecurities?
No, that's a great question, Tina. I don't have any off the top of my head, but I'm sure I know that our director, Kim Bethsefer, has been working with some of the other agencies or state agencies to try and align that, because we're in the same space that you are in of like, we're worried about like the healthcare, but people having food is directly linked to that. So how can we help our other state partners? It looks like Susie might have dropped a resource in the chat, but we can definitely take that back and see what other resources, excuse me, are available, and get those over to you.
Thank you.
Thank you. And then I assume we have your email, but if not, if you want to drop it in the chat, I can copy and paste it really quick. And then also, I don't know, you all have resources that Tina might need. If you guys would also like to share it with her. Sorry about that. Got something in my throat. All right, open discussion. Any other questions or concerns? Okay, seeing none, I have our contact info, Matt Bohannon, and myself, Chanel Pugh. If you guys have any questions or follow-up, please feel free to reach out to us. Any issues, concerns, we're always happy to kind of help out and support that or get you to the right person. So thank you for joining today and have a nice rest of your week. And happy Veterans Day. Thank you for your service for anyone that applies to.